So this is going to be Chapter 11 of our Emergency Medical Responder course, Substance Poisonings and Substance Abuse. So, a poison is a substance that causes illness or death when eaten, drunk, inhaled, injected, or absorbed in relatively small quantities. As EMRs, we can save patients' lives by quickly recognizing and promptly treating serious poisonings. Alright, so poisoning can be classified according to the way the poison enters the body. Ingestion, this is when we eat something, the poison is going to enter through the mouth and then be absorbed by the digestive system. Inhalation, when we breathe it in, poison is going to enter through the mouth or nose and be absorbed by the mucous membranes lining the respiratory system. So it's important to note that when we eat it, it's absorbed by the digestive system. When we breathe it in, it's absorbed by the mucous membranes lining the respiratory system. All right. Our next one is going to be injection. Here we have poison entering through a small opening in the skin, and it spreads through the circulatory system. So these are going to be bee stings, bites, or somebody injecting it with a needle. Absorption. The poison is going to enter through intact skin and spread through the circulatory system. So the difference here is that, one, we have a small opening that spreads it through the circulatory system, and absorption, this is where we have something just sitting on the skin and it's absorbed through the skin and into the circulatory system. Alright, so as with all of our patient assessments, we're going to start with our scene size up, make sure everything's safe, make sure we're safe, we got our BSI on. Next, we're going to hit our primary assessment. We're going to check those ABCs, life threats, all that good stuff. Then we're going to do a history. Can we find out what happened to the patient? What did they ingest? Do we know if they were stung by something? We got to be detectives on this, as you know, like I've told you before, to get a good idea of what's going on. And we're going to do our secondary assessment and our reassessment. So here it is, talking about our general assessment and treatment. We're going to follow our patient assessment sequence, like I just talked about. Obtain that thorough history from the patient or from bystanders. Be alert for visual clues that may indicate poisoning. Much of the emergency care that we provide with poisonings and substance abuse is based on the patient's signs and symptoms. All right. So some of our general signs and symptoms of poisoning, if they have a history of ingesting, inhaling, injecting, or absorbing a poison. Some signs and symptoms, we're going to see difficulty breathing or decreased respirations. In the digestive area, we'll see some nausea and vomiting, abdominal pain, diarrhea. With the central nervous system, could be unconscious or altered mental status. We might see dilation or constriction of the pupils, convulsions, maybe some excess salivation, sweating, cyanosis. We might see empty containers around the scene, smell something around the scene. It's all stuff we got to be looking for. So starting with ingested poisons, more than 80% of all cases of poisonings are caused by ingestion. Remember, ingestion is going to be eating something and having it absorbed by the digestive system. We might notice chemical burns, odors, or stains around the patient's mouth. Some early signs and symptoms are going to be nausea, vomiting, abdominal pain, diarrhea. And our later signs and symptoms could be abnormal decreased respirations, loss of consciousness, or seizures. So our treatment for ingested poisons, we're going to identify the poison. As we are on our way to the call, we might want to go ahead and, if we know what the poison is, if we know what our patient ingested, go ahead and give the poison control center a call. Find out what's going on and find out how to treat it. If you don't know until you get on scene, then the first thing we want to do is identify the poison. Then we're going to call the poison control center, find out how they want us to treat it. If we're unable to contact them, we want to dilute the poison by giving water, and we want to arrange for prompt transport to a hospital. Remember that as we are waiting for the ambulance to arrive, as we're doing our reassessment and such, we're going to go ahead and want to place those unconscious patients in the recovery position, help keep that airway open. Just something to keep in mind there. Depending on your local protocols, you might be indicated to give activated charcoal. This is a finely ground powder that gets mixed with water. So it comes as a powder and you get a cup, mix it up. It works by binding to the poison. So after they've ingested the poison, it's sitting in their stomach, getting absorbed. We're going to go ahead and give them the activated charcoal. They drink that down, and in the abdomen there, in the belly, that activated charcoal binds to the poison and prevents it from being absorbed into the patient's digestive tract. Now, we don't want to give the patient activated charcoal if they've ingested an acid or an alkali. An acid is a chemical substance with a pH level less than 7.0. It can cause severe burns. A base or an alkali, they have it as two different things here. They have alkali and base in the same place. As two different bullet points. A base is a chemical that has a pH level greater than 7.0. It's also known as an alkali or a caustic. An example of a base liquid, or a base is a liquid drain cleaner, just so you're aware. The other contraindication for activated charcoal is if they are unconscious. So here, this is how it comes. A little bottle, it's full of powder there. Usual dose is 25 to 50 grams for an adult patient and 12.5 to 25 grams for a pediatric patient. So right there, 25 to 50 adult, 12.5 to 25 for pediatric. Like I said, serve it in a cup. Usually they suggest that you cover it so that they can't see it. They might get a little nauseous about trying to drink it if they can see it. Vomiting. So we don't want to do anything to induce vomiting. It can cause more damage. So it can cause damage to the esophagus depending on what it is that they ingested. If they got it down, they got one of those acids or bases down, bringing it back up might cause more damage to the esophagus, so we don't want to induce vomiting. The American Association of Poison Control Centers does not endorse using Ipecac in children or adults. Ipecac is a type of, it was a drug to help induce vomiting. That's because this is how they used to treat this kind of stuff. And they believe that the activated charcoal is more effective and safer than that Ipecac syrup. All right, so inhaled poisons. These are the toxic substances that are breathed in and absorbed through the lungs. Some of them, like carbon monoxide, are very poisonous but not irritating, so they won't show signs and symptoms until after they've been inhaling it for a while. Where other gases, such as chlorine gas, ammonia, are very irritating, and you'll notice violent coughing, like almost immediately if they start inhaling this stuff. Some of our signs and symptoms, we'll have respiratory distress, dizziness, coughs, headaches, hoarseness, confusion, and chest pain. Some common causes of carbon monoxide poisoning would be improperly ventilated heating appliances. So people when it gets cold out and they bring in their propane stove but don't have any way of venting the air. Sometimes people bring in, grills, stuff like that to keep warm, and it causes them to ingest this, or causes them to inhale this carbon monoxide. Smoke from burning buildings is also another cause. So something to remember about carbon monoxide is that when it's in the air, it's 200 times more likely to attach to our red blood cells than oxygen. Remember that when we inhale a regular breath of oxygen, just like you're doing right now, that oxygen molecules will go down through the airway, hit the alveoli, get to the capillary bed, swap places with the CO2 that came from our body, and then the oxygen is transported throughout the body, correct? So when carbon monoxide is in the air, it will take the place of that oxygen molecule 200 times more readily, which prevents the oxygen from being transported through the cells. Some signs and symptoms of carbon monoxide poisoning. We're going to have headaches, nausea, disorientation, unconsciousness, flu-like symptoms. If you find several patients together who all report these symptoms, we need to remove everybody from the structure of the vehicle. So the furnace in their house is malfunctioning. It's not venting the carbon monoxide correctly. And they call for Meemaw, who already has respiratory problems. You're assessing her, and then all of a sudden her son and grandchildren start reporting the same things. Something's going on. We need to get everybody out. We also might see this in a vehicle when they might have a carbon monoxide leak in their exhaust system. So if you find multiple patients with the same signs and symptoms, get them out of the whatever structure, building, enclosed area that they're in, and get them into some fresh air. All right, some irritants. Ammonia. So often found in agricultural settings, they use it for fertilizer. Has a strong irritating odor. Occasionally they're used for smelling salts. Some people might have had them. If they get knocked out, they crack these things and you put them in front of the unconscious patient and they wake up. We don't use them really in EMS. A lot of sports teams, sports medics do. A little bit isn't going to kill you, but large amounts it will. It is highly toxic, causes violent coughing, and can cause skin burns. If we get into something like this, we need to remember that this is very quick acting. We should not enter any environment which contains the ammonia. Needs to be a hazmat team that's trained on how to extricate patients. They need to be wearing their CBA. So a quick picture of them using ammonia on a field for fertilizer, and that's the CBA that firefighters who are trained in how to use it will use to extricate those patients. Chlorine is another one that's commonly found around swimming pools, water treatment plants, severely irritating the lungs and upper respiratory tract. If any of you own pools and you throw those chlorine tablets in there, if you get a good whiff of it, you'll know what that feels like. Can cause violent coughing and skin burns. Once again, anyone who enters an environment full of chlorine needs to be properly trained and wearing a SCBA. Most of the places that you might go to that have these types of chemicals will have placards up like this. Able to use those numbers to find out what chemicals are present there. All right, so the treatment for inhaled poisons is going to be remove the patient from the source of the gas. If the patient is not breathing, we want to begin mouth-to-mask breathing, or personally, I'm going to use a BVM. If the patient is breathing, we want to administer large quantities of oxygen. Arrange for prompt transport. Remember, you might have to evacuate people before you can continue your treatments. All right, so injected poisons. Remember, injected poisons are ones that enter the body through a puncture in the skin. Major causes of these are animal bites and stings, so snakes, scorpions, spiders, bees, wasps. And toxic injection would be somebody intentionally injecting it into their system. Some signs and symptoms: obvious injury site, a bite or sting mark, tenderness, swelling, red streaks radiating from the injection site, weakness, dizziness, localized pain, and itching. So the best treatments for this is to keep the patient calm and still when that poison has entered their bloodstream. It's circulating through their blood. If we can keep them calm, that's going to slow their heart rate down, which keeps it from moving around as fast. You know, when they're worked up, freaking out about it, their heart's beating, just going to town, and it's circulating that poison faster. So we need to try and keep them calm. We want to wash the site with soap and water. Remove any stingers using a gauze wiped over the area or your fingernail. You do not want to squeeze that stinger. The other way that I know is to use some type of credit card to swipe it out. We can use ice packs to reduce swelling and pain. Now, some people may experience an extreme allergic reaction and go into what's called anaphylactic shock. And this is going to cause itching, hives, swelling, wheezing from their airway, and respiratory distress. Going to see generalized weakness, loss of consciousness, rapid weak pulse, rapid shallow breathing. Blood pressure may drop. They might become hypotensive, so low blood pressure. And that's going to put them into what's called hypovolemic shock. If this is to happen, we want to maintain patient's ABCs, airway, breathing, circulation, administer that oxygen if available, treat for shock in some cases. Treatment for that is to first remove the allergen if possible, so we need to get that stinger out. Don't squeeze it, remember that. Now, if they're bitten by a snake, that doesn't mean that we suck the poison out. Monitor the patient's vital signs. If the patient's condition is progressing to the point of respiratory or cardiac arrest, we need to begin helping them breathe, CPR if they do go into cardiac arrest, and these people need immediate rapid transport. A lot of the paramedic level services will have some drugs to help counteract this. BLS services with just EMTs on it, might not. So something you need to remember: know the local service that's going to be coming out to your area. Now, some people know that they are allergic to bees, wasps, whatever, and they have a auto injector. This is epinephrine, and it's going to help alleviate the symptoms. Most of them should know how to use it. You can assist them. I'm going to place the tip of that auto injector against the outer thigh, push it firmly against the thigh, and hold it for several seconds so all the medication goes in. Snake bites. So there's 4 kinds of venomous snakes in the United States. We have the rattlesnake, cottonmouth, copperhead, and coral snake. As most of you know, all of these can be found in Oklahoma. Coral snakes are more northern Texas, southern Oklahoma. But everything else, we do have all these snakes in this state. The snake will inject its poison into a person's skin and muscles with its fangs. So some of you might know that adult snakes have some sort of control over how much toxin that they inject into a person. The younger snakes that are just hatched, just out of the egg or whatever, they don't have as much control. So with the adult snakes, you might see if you get bit, you might receive a smaller dose, whereas those young snakes can inject all of their poison all at once. They don't really have much control over it. Signs and symptoms: we're going to have immediate pain at the bite site, swelling and tenderness around the bite site, fainting from the emotional shock, sweating, nausea and vomiting. They might go into shock. The coral snake, their toxin is a little different. May include these additional issues. We might have some respiratory problems, slurred speech, paralysis, coma, or seizures. Once again, for treatment, we want to keep that patient calm and still, try and not circulate that toxin through the body. We want to have the patient lie down and try to relax. We're going to wash the bite area with soap and water. If the bite occurred on the arm or leg, we want to splint the affected extremity. We do not want to put a tourniquet on that wound site. It doesn't help. We want to treat the patient carefully and arrange for prompt transport to a hospital that has antivenom. Now, we might not always know what type of snake. People say they can identify every snake, but a lot of them can't. If the snake is still on scene, a lot of times people will kill that snake. If you can bring the head with you, it's a great way to help identify what type of snake that is. So our absorbed poisons, these are the ones that get into our body, into our circulatory system by absorbing through the skin, obviously. Some common ones are insecticides and toxic industrial chemicals. Some signs and symptoms: you probably see traces of powder or liquid on the skin and inflammation or redness around those sites. So right there, that's our chemical burns and our skin rash. Might be burning, itching, might have nausea and vomiting, dizziness and shock. Treatment: we want to ensure that the patient is no longer in contact with the substance. If it is a powder, we want to brush it off. Do not wash. If you add water to a lot of these dry chemicals, it can activate the chemical even worse and result in a burning reaction. Once we get all the poison off, patient gets stripped down, take their clothes off, and then we want to wash those patients for at least 20 minutes. Remember that some of that might have gotten into their eyes, so we need to make sure to rinse their eyes as well. If additional EMS personnel are delayed, contact poison control. So I think we talked about that earlier. It's a good idea to contact poison control anytime. They might have additional treatments. If the patient is experiencing shock, have the patient lie down. We're going to elevate the legs. And if they're having difficulty breathing, we want to administer oxygen. Don't withhold oxygen from anybody. Nerve agents. So nerve agents can be absorbed through the skin, inhaled or injected. They are among the most deadly chemicals developed. Even small quantities can kill large numbers of people by causing cardiac arrest within minutes of exposure. So a lot of these were originally discovered by scientists when they were trying to find insecticides. These are all much stronger than most insecticides that are used. Four most common are sarin, soman, tauben, and VX gas. When exposed, nerve agents block essential enzymes in the nervous system and will cause these sludge M-like symptoms. This is an acronym that we use, sludge M. So sludge is salivation and sweating, lacrimation, this is excessive tearing of the eyes, urination, defecation, drooling and diarrhea, gastrointestinal upset and cramps, emesis, which is vomiting, and we'll also see muscle twitching and pinpoint pupils, meiosis. Be the bigger signs and symptoms, but we also might see shortness of breath, a slowed heart rate, muscle weakness, twitching and paralysis, slurred speech, seizures, loss of consciousness. So it's important that if you are called to a scene of a nerve agent poisoning, you need to keep yourself, rescuers, and bystanders from being contaminated. Well-trained hazmat teams with special equipment. This is more than just the SCBA we talked about earlier. They have suits that they wear. They are the ones that are needed to remove and decontaminate these people. Like I said, they're using SCBA and encapsulating suits to prevent exposure. As always, our first treatment in our primary assessment and everything else is to assess and support the patient's ABCs. Nerve agent antidote kits, they are available. Some services still use them, not always. They're an auto injector like that epi injector that we talked about in injections with the bites and stings. Contains atropine and pralidoxime chlorine, 2-pam chloride. So if you have access to that, you want to, and this is all going to be based on your local protocols, your medical direction. We want to check the kit, make sure it contains the proper medication, has not expired. You can remove the cap, press the green end of the injector firmly against the lateral part of the patient's thigh. Hold for 10 seconds, allow medication to get in the muscle. We want to dispose of that syringe and reassess patient's vital signs and symptoms. Like I said, this is all based on what your protocols say. I don't know of a lot of people that even carry these anymore. So substance abuse, according to the National Survey on Drug Use, 8.1% of the U.S. population, that's 21.5 million people, have a substance abuse disorder or are dependent on drugs and alcohol. Substance abuse results in increased incidence of injuries and illness. Even if the primary reason for the call is not substance abuse, it still can be a contributing factor. So, important to remember there that this is widespread, that there's lots of people that are affected by this. All right. And our number one abused drug is going to be alcohol. It's involved in a significant number of traffic fatalities, murders, and suicides. It's important that to remember the symptoms of alcohol intoxication are similar to those of other medical illnesses or severe injuries. So you need to be careful with your examination. Don't always assume that the symptoms are caused by the symptoms of what's going on with them are caused by the alcohol. Could be something else, and that includes smelling alcohol on someone's breath. As we know from when we talked about diabetes, people with hyperglycemia might be breathing off like a fruity smell. Sometimes that can be mistaken or might be attributed to alcohol. It's not always the case. So alcohol is an addictive depressant drug. Persons physically dependent on alcohol can develop severe withdrawal symptoms. These are called delirium tremens or DTs. People trying to better their lives. You know, they've been heavy drinkers all their lives. All of a sudden, they want to get off of the alcohol, try and make themselves better. Could start experiencing these. Prisoners who have recently been incarcerated. Once again, they've been drinking alcohol for all their life, and now they're locked up, have no access to it. It might be a cause of something that's going on with them. So we might see shaking and restlessness, confusion, hallucinations, gastrointestinal distress, chest pain, fever. This is a serious medical condition and can be fatal, needs to be treated as soon as possible. So drugs that people take may be ingested, inhaled, injected, or absorbed into the body. So we know that people eat pills, inhale marijuana, methamphetamines, crack, whatever. They can inject it. Most everything can be injected. Sometimes it's absorbed into the body, LSD, stuff like that. We need to look for clues that indicate the type of drug and the way it was administered. So do we see, crack pipes laying around? Do we see needles and syringes and tourniquets, pill bottles laying around? It's all stuff that we need to look, when we're doing our scene survey. Abuse of prescription drugs has increased in recent years, so a lot of people using painkillers to get high. Amphetamines, they stimulate the central nervous system, maybe called speed, ice, crystal, cocaine. Signs of amphetamine use include restlessness, irritability, talkativeness. We need to keep the patients from harming themselves and transport them to a facility. Pain relievers, these are opioids. They mimic opium, morphine, such as that. Might be hydrocodone, Vicodins, oxycodone, Oxycontin, morphine, codeine, fentanyl. There's a bunch of different ones. Signs and symptoms. So these ones, where our amphetamines were uppers, they got you moving around, increased heart rate, increased breathing, all that good stuff, increased agitation. With our opioids, we're going to see a slowdown in everything. They're going to have slow, shallow breathing or no breathing, pinpoint pupils, weak pulse, low blood pressure, might be bluish coloring in the nails and lips. That's cyanosis, remember. They might be drowsy or disoriented. Could be delirious, possibly in a coma. Are one of the drugs that we give to counteract opioid problems is Narcan. It rapidly reverses the effects of opioid drugs on the central nervous system. A lot of people are now carrying it. I know police departments that are carrying it, fire departments that are carrying it. It can be administered intranasally or auto injection, kind of like the EpiPen or that 2-PAM chloride. Once again, only if you're trained and have approved from your medical director are you allowed to give it. When you do, you need to, a lot of them come pre-ready. It's just like the nasal allergy medications. You squeeze the bottom of it and it mist up into their nasal passages. We just place it in one nostril, squeeze it, and it administers whatever needs to be done. If it comes in a syringe, then you'd have to attach the atomizer. Everything would come in the box for you. You'd attach the atomizer, place it in one nostril, inject half. They usually come in 1 milliliter doses, they come in 2 milliliter doses, and you inject half into each nostril, so 1 milliliter in each nostril. After that, we want to reassess the patient and document anything that we've done. So hallucinogens, these are going to include PCP, LSD, acid, peyote, mescaline, mushrooms. These are going to cause people to see things that are not there. Signs and symptoms of a PCP overdose include convulsions, coma, heart and lung failure, stroke. We want to reduce auditory and visual stimulation, so things that they hear and things that they see. Need to approach each scene with caution because some of these patients can get violent, and we need to arrange for transport. All right, abused inhalants. These are going to be intentional inhalation of volatile chemicals. A lot of these we can find at the hardware store, the auto parts store. Going to include gasoline, spray paint, carbon choke cleaner, those kind of things. They might cause drowsiness, unresponsiveness, seizures, or sudden cardiac death. We want to try and keep the patient calm and still. Support the patient's ABCs, give high flow oxygen, Monitor vital signs, arrange for prompt transport. So toxic injection from drugs, these are the ones that patients are injecting into themselves. Reaction depends on the quality and type of drug injected. We might see, there's all kinds of drugs that they inject, heroin, methamphetamines, there's all kinds of different stuff. Signs and symptoms we need to treat are going to be weakness, dizziness, fever, and chills. We need to support the patient. Like I said, treat the symptoms. Provide transport to a medical facility. You can check the injection site for any redness, swelling, increased skin temperature, or indications of infection. Something to remember with people who use IV drugs, or any drugs in that matter, they do have a high incidence of bloodborne diseases such as Hep B, Hep C, AIDS. We need to make sure we're using our BSI, keeping our gloves on so we don't come in contact with it. Our general treatment for drug overdose is to provide basic life support, ABCs, keep the patient from hurting themselves or others. We need to provide reassurance and emotional support, let them know that we're trying to help, arrange for that prompt transport, administer naloxone, Narcan, if we've been properly trained and authorized. So going back and looking at we need to remember that Narcan is used for opioid overdoses. We need to look at our signs and symptoms and remember that these are downers, so our blood pressure is going to be decreased, our breathing is going to be decreased, heart rate is going to be decreased. Now, it won't hurt somebody who's on meth or crack or whatever to get the Narcan, but if we're intelligent about what that drug is used for, we know when to give it and when not to. Remember, that's also if we've been properly trained and authorized by our medical director. We need to avoid classifying and judging these patients. Yes, they do have issues, but we can't judge them, can't classify them as drug addicts, and not give them the attention and the treatment that they deserve. Remember, all patients need to be treated the same. Intentional poisoning, so people who have ingested something with the intention of killing themselves, it's an emergency treatment. The emergency treatment we give is the same as for anybody else. We need to remember that these patients need both medical and emotional support. They need help psychiatrically as well as medically. So this is pretty much the end of the chapter here. Something we do need to go over really quick is excited delirium. A lot of patients, not a lot of patients, but some patients, especially those with psychiatric issues who are also drug addicts, maybe they're going through alcohol withdrawals, they become severely agitated, have anxiety, paranoia, might be hallucinating, disoriented, insensitivity to pain, elevated body temperatures, and superhuman strength. A lot of these guys, you'll see them running buck naked down the middle of the street, and it will take every law enforcement officer on the force to get these guys down. They might use a taser on them with no effect at all. Once they do have them detained and you're actually safe, your goal is to prevent them from going into cardiac and respiratory arrest. This happens quite often. A lot of times the use of physical restraints seems to worsen this, so we need to try and minimize their use. We need to recognize this excited delirium. Now, your ALS personnel, the paramedics, ALS is advanced life support, in case we haven't talked about it yet. They do have medications to help reduce the anxiety. Sometimes this does not work even then. Just something to remember. It is in the book here at the very end of the chapter, so take a look at that. All right, so for summary, our two major causes of poisoning by injection are animal bites and stings and toxic injection. So animal bites and stings, and then somebody actually intentionally injecting themselves with something. Remember, poisoning by absorption occurs when poisonous substance enters the body through the skin. Nerve agents are the same types of chemicals as insecticides. They're just stronger. Our role is in incidents involving nerve agents is to keep yourself and others from becoming exposed. We need to pay attention to scene safety and do not enter hazardous environment without the proper training and equipment. Review. The most common route for poisonings is injection, ingestion, inhalation, or absorption. Remember we talked about this one right off. It's people eating things, so ingestion, which was B. Which of the following would not be considered appropriate management of anaphylactic shock? So which ones would not be correct? Would we withhold oxygen? No. Would we remove the allergen? Nope, we're going to do that. Would we induce vomiting? Nope, we're not going to do that. Would we arrange for immediate transport? Yes, we are going to do that. So looking at that, reduce or induce vomiting. Remember, we don't want to induce vomiting on anybody. Which of the following are common causes of carbon monoxide poisoning? Air conditioning units, cleaning supplies, improperly vented heating appliances, or paints and paint thinners. So remember, carbon monoxide is produced when things are burned. Nothing is burned with your air conditioner. Cleaning supplies, you're not burning anything there. Paints and paint thinners, not burning anything there. So it's going to be our improperly vented heating appliances. Alright guys, that was Chapter 11, Poisoning and Substance Abuse. We'll see you next one.